Good evening, viewers. My name is Brian Matwango, and you're watching Green Powers, a platform which is dedicated in exposing environmental issues and advocating for a healthier community. So today we are joined with a health practitioner. Ma'am, can you kindly introduce yourself?
Well, thank you for inviting me into this short interview, I suppose. My name is Sister Sithole. I've been in the nursing profession for the past 34 years.
Wow.
And I'm currently working under one of the government hospitals.
Wow. That is good. So, ma'am, we are seeing that in Zvishavane communities, we are facing challenges pertaining the overflowing of sewages, and there is an issue of where people they are throwing litter everywhere, in roads, in towns, everywhere. So, I want you to explain about it. How do you see it?
Okay. Unfortunately, on today's observation, things haven't been going the correct way, unlike what used to be done a few years back when I was still young. We never used to see any flowing sewer wastages in the roads. It used to be intact. Unfortunately, a lot of things have been happening. Wouldn't blame anyone. It could be through natural disasters,
Yes.
and also littering of waste by humans, and the poor removal of plastic waste in some of these areas whereby there are trenches which are supposed to be swept before the rain falls.
Okay.
Resulting in the blockage of some of the stations where this sewer is supposed to be draining. That's number one cause.
Okay.
And whereby I would say it's a human error. Unfortunately, some of the things could be the responsible people
Yes.
are not taking care, and they are just overlooking. It is a sore eye to see some of these things whereby the right people would pass through that area and not put an effort or take actions in time. And I would say this would lead to a lot of diseases in the community. I remember there's a time when I would walk around the community. We find young children playing. It's a must, these children should be playing, but unfortunately they'll be playing where there is that waste and ending up with diarrhea, vomiting, and all sorts of problems. Even the adults are affected. Even when you are driving, your car will end up being kegged in mud. And in the end, you start, me as an adult, I would love to be using a road whereby everything is intact. In short.
Okay, I get you. So, another question. How does the health department address environmental health hazards here in Zvishavane?
Well,
How are they addressing the problems?
I do agree, they do address. Unfortunately, it is shortage of resources and human resources.
Okay.
Material resources and human resources.
Okay.
They are trying by all means. It's unfortunately, like I said, human and material resources are scarce.
Okay.
We do have,
Yeah.
we do have the environmental technicians, I would say, in our hospital, whereby they can identify a problem, but because of that lack of the resources, it becomes a mystery to them or a nightmare for them to conduct their duties.
Oh, okay. So, what strategies can healthcare professionals use to educate the public on the dangers of pollution which is being caused by the litter and the sewage which are flowing everywhere in streets, especially in towns or homes?
Oh, well,
Yeah, what strategies can they use to solve the problem?
One good strategy is the one which you have implied now.
Okay.
You are talking to me, whereby we are highlighting where we are heading towards this menace. And another way is to give awareness to the community through media,
Okay.
social,
It's true. Yes. Okay.
social media,
Okay.
and gathering of people in my community.
Okay. Another one. What actions can individuals can take to reduce the pollution and protect their health? Like in homes, like in the streets, what can they do to avoid like the pollution
Okay.
or being affected?
Health education to all. It will start with the family.
Okay.
Then we can spread it to schools and everyone else.
Okay. Last but not least, what partnership exists between the healthcare sector and environmental agencies to tackle pollution related to health concerns?
Come again?
What partnerships exist between the healthcare sector and environmental agencies to take pollution related to health concerns? Where, like, do you get it?
Yeah.
Oh, okay.
We do have my stakeholders such as the council,
Yes.
our municipality,
Okay.
our own environmental technicians which are based in the hospitals, and individual communication
Yes.
that can assist in handling this problem. As long as we come together and talk about it, I think we can win the war, especially when educating each other in littering of these plastic nappies, pampers, which are a menace now. They are some of the causes of these blockages, and I suppose
Yeah,
that's it.
it's true. I second you. Oh, thank you so much for taking this time to share your thoughts. It was a good time having you and sharing to the communities what they can do, like which strategies they can use to avoid littering and the overflowing of sewages. So, see you next time. Bye bye.
It was a pleasure having you
Okay, thank you.
around.